Thank you for joining. My name is Jeff Christie, and this presentation is part of 4320 EMS Systems Design at Columbia Southern University, and the due date is August 20th, 2025. The focus of this project is developing a comprehensive mental health and stress management program for EMS providers. The following proposal builds on existing evidence based practices and is tailored to address the unique stressors faced by these EMS professionals. EMS professionals encounter repeated exposure to trauma, high pressure situation, uh, decision making, and long shifts. These occupational stressors contribute to elevated risks of burnout, depression, anxiety, substance use, and suicide. In our organization, mental health coverage is limited despite being part of the largest hospital system in New Jersey. The core mission of this program is to improve how we care for those who are caring for our communities. By implementing a structured mental health and stress management initiative that blends both internal resources and outside expertise. Excuse me, turn that down. It's conservative to say that our current mental health resources are insufficient. Substance use, whether it be alcohol, nicotine, caffeine, or controlled substances in some cases, are increasingly prevalent amongst EMS providers. Burnout rates are climbing, and changes are becoming visible across the department. Excuse me. A thorough needs assessment confirms that our workforce requires improved access to mental health care, resilience training, and structured peer support. The goal is to create a proactive rather than reactive approach to EMS mental health care. The program will combine internal staff and qualified external mental health professionals. One representative from management would serve as an initial point of contact for major concerns, but remain outside direct intervention roles to protect confidentiality. The program will begin as voluntary and over time would become mandatory after certain high stress incidents, such as anything pediatric related, whether it be trauma, suicide attempt, um, or cardiac arrest. Excuse me. Over time, the goal is to transition to a more consistent participation with peer support, critical incident debriefing, therapy access, and resilience training as their core components. Confidentiality has to be the foundation of the program. I think it would be best to use a third party hotline to serve as the initial first point, ensure privacy throughout the entire process. This removes the fear and internal stigma and provides accessible 24/7 resources for the staff. Flexibility in access, both in person and in virtual, will allow participation from all regions and all shifts, whether it be days or nights. Silence that. Our organization has significant internal resources, which can keep the costs minimal or maybe even cost neutral. By leveraging existing hospital mental health staff, training departments, and facilities, the program can operate without substantial new expenditures. Sponsorship opportunities do also exist, and being able to partner with a community mental health agency could also further offset costs. The ultimate goal is to deliver a high quality product without creating a financial burden. If you consider the unaddressed mental health, excuse me, if you consider the cost of an unaddressed mental health needs, I don't know where I was really going with that. Let me back that up. Basically, one of the examples I chose here is you have a brand new EMT, starts at $25 an hour. This is their first EMS job, and they experience something that is very traumatizing to them where they feel like they need to take some time off, and rightfully so. That's going to cost their sick time at $25 an hour, and very likely somebody to be covering that shift on overtime. So the hidden cost behind this is we're paying now 2.5 times the base rate, and for paramedics, that's nearly $100 an hour for something that could be reduced. And a structured mental health program can reduce these costs and occurrences, making it a cost avoidance strategy as well as a wellness initiative. To implement this program effectively, the staff must be trained in peer support techniques, such as critical incident stress management, mental health awareness, and first responder specific resilience skills. This includes EMS specific and military aligned mental health strategies for relevance. And training should be phased instead of all at once to ensure that all staff are prepared without disrupting operations. Program evaluations will be a blend of both quantitative and qualitative methods. Qualitative data, quantitative data will include sick time utilization, overtime replacement hours, and retention rates before and after implementation. Qualitative data, on the other hand, can be gathered through anonymous surveys and structured feedback sessions, allowing participants to share their experiences and suggest improvements. Quarterly reviews will be conducted, producing 4 evaluations annually, and these will be compiled into an annual report that includes data from all regions within our department. To ensure neutrality, evaluations will be completed by a reviewer outside of our department, but within the hospital network. This will keep costs down while maintaining objectivity. Feedback will be directly, excuse me, feedback will directly inform program modifications. If participation is lagging, adjustments will be made to the scheduling, format, or content delivery. If certain interventions are proving especially effective, they'll be expanded upon. The goal is to maintain a living program that evolves alongside the workforce needs. EMS professionals work in a high stress, high stakes environment with persistent exposure to trauma. Without structured mental health support, this leads to burnout, attrition, and increased costs due to sick time and turnover. A dedicated program addresses these risks, supports your staff, and protects community service delivery. The program improves workforce stability, reduces financial losses from unplanned absences, and fosters a culture where seeking mental health is encouraged, not stigmatized. By using a mix of internal resources and targeted external partnerships, we can provide comprehensive, confidential, and sustainable mental health for our EMS professionals. The last 2 pages are references that were used. Thank you so much for your time.